Hello, I'm Dr. Andrew Vantreese, and I'm the author of the book, How to Be a Winner, a lifestyle guide to achieving and maintaining health. I practice brain-based therapy, and today we're going to talk about insomnia. In simple terms, insomnia is the inability to get a good night's sleep. Insomnia is not defined by the number of hours you sleep. It's not defined by how quickly you fall asleep, and it's not defined by how early you wake up. Instead, it depends on the quality of your sleep. If you're still feeling drowsy or fatigued the following day, despite sleeping 6, 7, 8 hours a night, you may be experiencing insomnia. And there are three categories of insomnia. Transient. This is insomnia which lasts for just a few days. Short-term insomnia. This lasts for no more than 3 weeks. And finally, chronic insomnia. This occurs at least 3 nights per week for 1 month or longer. Now, according to the National Center on Sleep Disorders research, 30 to 40% of Americans report suffering from 1 or more nights of insomnia during any given year. But about 10 to 15% of Americans suffer from chronic insomnia. And while chronic insomnia is not deadly in and of itself, it can lead to a whole host of other disturbing mental and physical effects. For instance, memory capacity and speech control diminish. Our irritability spikes. Concentration is kaput. The muscles ache. The amygdala, the part of the brain that alerts the body to be prepared in times of danger, goes haywire when a full night's sleeplessness occurs. Cortisol, a hormone related to stress and depression and also linked to cardiovascular disease, builds up in the body instead of being moderated by a good night's rest. Also, according to the U.S. Department of Transportation, there are about 200,000 accidents a year caused from sleepy drivers. This is more than drunk driving. Now, the thought of a pill that can solve your sleep problems quickly is very appealing. However, sleep medications don't cure insomnia, and they can often make the problem worse in the long run. Concerns about the use of both over-the-counter and prescription sleep medications include drug tolerance. You may have to take more and more of a drug just to get the same effects. Drug dependence. You may come to rely on that sleep medication just to fall asleep, and you may even have worse sleep without it. Withdrawal symptoms. If you stop the medication abruptly, perhaps you run the risk of experiencing withdrawal symptoms such as nausea, sweating, and shaking. Side effects. There are several side effects to sleep medications such as drowsiness the next day, confusion, forgetfulness, and dry mouth. These side effects can be severe. Drug interactions. If you are taking other medications, sleeping medications can interact with them. This can worsen side effects and be dangerous with medications such as prescription painkillers and other sedatives. You may experience rebound insomnia. If you need to stop the medication, sometimes the insomnia can be even worse than it was before you started taking it. And finally, and most importantly, you may be masking an underlying problem. There may be an underlying disorder that, if treated, would provide more relief from insomnia than the medication. And that's where brain-based therapy comes in. In my clinical experience, insomnia is the result of an overactive mesencephalon. There are 3 parts to the brainstem: the pons, the medulla, and the mesencephalon. 90% of our cortical output goes towards the pontomedullary area, the lower brainstem, and this helps suppress the upper brainstem of the mesencephalon area. If we lose that brain loop, you might be experiencing insomnia. So with BBT, we do a complete neurological examination to determine which part of the brain and nervous system is not functioning properly, and then we treat it. We treat the true cause, thereby eliminating your insomnia. And we do that with fuel and activation. Fuel comes in the form of oxygen that we provide here at our office, and activation comes in the form of the therapies that we do. I'd like you to watch the Introduction to Brain-Based Therapy video on our home page of our website. There you'll hear more about BBT and the therapies we use in our office to increase activation to the dysfunctional regions of the brain. I look forward to working with you. I look forward to helping you, and I look forward to the increased productivity and happiness and health in your life that you're going to get after getting a good night's sleep. Thank you.